As our population ages and lifestyles become increasingly sedentary, we see a rising trend in osteoporosis. According to the International Osteoporosis Foundation, an estimated 1.5 million Malaysians over the age of 50 are affected by osteoporosis, with women being at a higher risk than men. Good day. My name is Jeremy Teo. I hope you're doing fine. Thank you so much for joining us on our show today, Body and Balance, the importance of bone health. For those of you who are watching and listening in to us talk about bone health and its importance, please do share this show with your friends and family. I'm pretty sure the entirety of what we're going to be talking about today will be beneficial to many people. So spread that awareness and get the good word out. Now, also, if you have any questions, feel free to leave a comment. We'd be more than happy to try and answer them as we see them. But of course, let's get right into the meat of things. In order to gain a deeper understanding of the topic today, we have two speakers who will be invaluable in sharing their knowledge with us. The first of which is Dr. Putra Vatakal, orthopedic and arthroscopic surgeon. Hello, doctor.
Hello. Hi. Good day, Jeremy. How are you?
I'm great. Thanks for joining us. I know you're a very busy man, so we really appreciate you coming in and taking time out from saving lives to join us on this chat.
I'm so excited to be here, and I look forward to a wonderful discussion with both of you.
Now, we also have Wong Shan, the consultant nutritionist, LAC Malaysia. Hello, Shan.
Hi, Jeremy. Hi, Dr. Putra. Nice to see you both.
I'm so glad. The two of you are here because lots of questions. Your expertise is duly very, very sorely needed. But before we start things off, though, just for the benefit of our viewers, maybe we find out a little bit more about what your jobs entail. We'll start with you, Dr. Putra. What does an orthopedic and arthroscopic surgeon do?
Well, basically, I treat injuries and disorders or diseases of the bones and joints. This is something that I do. I don't know whether you can see that. That's a replacement for a joint. So that's one thing that I do. But it's not just replacements. Anything that goes wrong with, I don't know whether you can see this with a green screen, but that's a joint, a knee. People think of orthopedic surgeons as dealing just with the bone, but we do anything that goes wrong with the bones, the joints, things from injuries to wear and tear of the joints to weakening of the bone, which is osteoporosis, something we're going to talk about today. So all that comes under the things that I do.
Wow, it sounds like a very intense and important job, I have to say.
Agree.
Shan, what about you? Consultant nutritionist. What do your duties include?
All right. Okay. So for me, right, as a nutritionist in LAC Malaysia, what we do every day is educate customers how to live healthily in terms of how to eat well, okay, live well. And also, let's say if you're not able to take sufficient nutrients from your food, okay, from your daily food, then it's essential to take supplements. So that's what we do every day.
All right, very cool. Obviously, the two of you, your knowledge is going to be absolutely essential to our discussion for today. So let's get right into the meat of things. Dr. Putra, we'll start with you. What are the common joint and bone disorders? How does age influence bone health?
It's interesting that you ask about age, because when you talk about bone and joint disorders, we divide them into those that happen in younger people. And that means things like injuries. You're playing sports like badminton, football, and you twist your knee, you twist your shoulder, something like that. Those are injuries that happen in younger people. When you get to older age groups, then you get things like wear and tear of the joints. We call that osteoarthritis. Now, that's a very big word that simply means that the joint linings have become very rough and it's painful when they walk. And it's confused because osteoarthritis and osteoporosis sound very similar. But osteoporosis, which happens in older people, is when the bone gets weaker. And that's, I think, what we're going to focus the most on today. So that's the range that I see. So it's important to take care of your body as it ages.
All right. I mean, like you mentioned earlier on, a little bit of sports and stuff like that. It's obviously a lifestyle thing. So Shan, I was just wondering, aside from the lifestyle things, does that mean I shouldn't be playing so much sports? Should I be staying at home and relaxing and minimizing the impact on my bones?
Now, yeah, you see, Dr. Putra is already showing you a no-no, right? Okay. Okay, maybe before I answer to your question, what about you? Are you someone who is active or not?
I try to be, but I'm probably not as active as a doctor would recommend.
Okay, all right. So how often you actually work out or maybe exercise in a week?
Well, I would like to say about like once or twice a week, but even then, sometimes it gets a bit sketchy, you know?
I see. Okay, at least you move around. Okay. All right. Okay, definitely there are many lifestyle factors that would negatively impact our bone. Okay, so regardless you are active or you are not active, you are at risk at getting osteoporosis. So let's say if you are active, right, and during your any workout, like any exercises that you do, I believe you sweat, right?
Mm-hmm.
Yeah, you
For
will
sure.
definitely
Yeah.
sweat. So throughout this kind of perspiration, actually you lost calcium, as calcium is one of the electrolytes in your body. So yeah, if you're active, you definitely need to make sure that you are taking enough of supplementation of calcium. And if you're not active, actually when you're not active, right, your bones and your muscle, they work mostly the same, okay, whereby you need to work them, you need to pressure them only, then they will grow, you know. So
Oh, okay.
you see, yeah, a little bit of pressure is good. So yeah, so if you are sedentary, you don't do anything, you are doing a couch potato every day, right? Watching television. So it's not too good for your bone also.
Right. Okay, that's very
Am I right,
interesting.
doctor?
Yeah, totally agree.
Oh,
Yeah,
okay.
and then yeah, allow me to add on
So go
something
on, go on. Yeah.
also. Can I? Yeah.
Yeah, go on.
All right.
Yeah.
Allow me to add on something. Another thing that Malaysian are actually indulging every day, or I would also say addicted to every day. One of the beverage that you may drink every day. Okay, Jeremy, would you like to make a guess? What kind of drink is that?
Uh, every day. It's got
To
to be
certain
like it.
people,
Is it like it's either soft drinks or coffee, right? Is it one of those two?
you are so smart, Jeremy. Yep, you are definitely correct. Both of them, actually.
Oh wow.
Yeah, both of them. Yeah. So yeah, you see like soft drink or we call maybe sodas. Okay. Sodas are like high in sugar, and then like coffee, you know, high in caffeine. And you know, Malaysian, a lot of Malaysians, they can't live without coffee, right? So yeah, actually both of these beverages will draw calcium out of our body as well. So you see, if you drink too much coffee, you tend to visit the toilet more often than you used to be.
Okay, that
Yeah,
makes sense.
so
Yes.
yeah, correct. So
So maybe
throughout those
don't drink so much
processes,
coffee.
yeah, you can take, right? Everything you need to take moderately.
How many cups of coffee did you drink today, Jeremy?
Yeah.
I'm on my. I've already had two. Is that too much?
Sounds okay.
Okay. Yeah, 1 to 2 is still fine, but you know, coffee tends to make us addicted to them, right? When you started off with 1, 2, then later on it's going to be 3, 4, right? And it goes on. Yeah, that's because actually they won't stay in your body for long. So during your perspiration and like when you visit the toilet, you urinate, so it will get out of your body. So you need to replenish again. So yep, you
Right.
can drink coffee, but make sure you get enough calcium in your daily food also.
Got it. Well, thanks for that. So, doctor, earlier on, Meshan said like there are definitely risks for osteoporosis, even if you have an active life or you have a sedentary life. It's just there. Now, how can a person know if they are at risk for it or other bone diseases?
You know, the thing about osteoporosis is that it is a very silent thing. You don't feel any pain. You don't know that you have the disease until you suddenly break your bone one day. Now, when you talk about osteoporosis, why is it dangerous? Because your bone becomes weak. Normally, the bone is quite strong, right? You can see that. And when it weakens, even normal activities like just falling, usually we call it falling down from a standing height. When you think about breaking a bone, I'm sure the first thing you think about is, you know, some kind of car accident or, you know, a big fall. But people who have osteoporosis, they get broken bones or fractures just by normal everyday things like standing up and suddenly they just knock into something, they fall down, they get a fracture. Most commonly, that happens in the back, in the spine, it happens in the hip, and it happens in the wrist. These are the common areas. Now, why am I telling you this? Because osteoporosis does not, it usually goes undetected until you have a fracture. So you need to know how to suspect that you have it, which is your question, right, Jeremy? So the things that most commonly we see is that in ladies especially, it is age dependent because once a woman hits the age of around 50, they go through a period called menopause, right? So during that period, there are hormonal changes in the body that weaken the bones ultimately. So age especially in ladies after 50. In men, this happens after the age of 70. So age is the first thing. But it's not just age. If you're on some medicines, like if you're on long-term treatment with things like steroids, with treatments for cancer, these strong medicines can actually weaken your bone as well. So medicines is another thing. And then your habits, as Mishan was mentioning about too much coffee intake, too much soft drinks, these are things. So risk factors are divided into all these things. I think we really have to look at your lifestyle. You have to look at your age, at your another thing is if you've had a family member before who has had a fracture related to osteoporosis, that is a risk factor. So there's so many things. We probably can't go through all of them, but we have to know how to prevent osteoporosis, which I think will be one of the more interesting questions today.
Yeah, it's so interesting that you spoke about the three factors. There's obviously like the age and then maybe a family history, but it seems to me like these two, you can't really help. You grow older and you can't pick your family. So which leads to the third one, lifestyle. So in terms of like the lifestyle factor, Mishan, are there any dietary changes that can help maybe prevent osteoporosis? Any foods that are especially good or bad for bone health? I know we covered some caffeine and some like soft drinks. Is there anything else we should be aware of?
Yeah, definitely. Okay, like what you mentioned, age, it's irreversible, okay? Family history, we cannot avoid also, right? So from diet changes, that's the thing that you need to do. And yeah, like actually, it's good to be disciplined, okay? Like what you mentioned, what kind of food that is actually high in calcium? Okay, first and for all, I believe you guys should know, milk. Milk is one of the most abundant source of calcium, okay, from our daily food. Okay, but then before I proceed, Jeremy, do you drink milk?
In my coffee, does that count?
In your coffee? This is what my customers always tell me, right? So they will be asking me, hey, Mishan, can I add milk in my coffee? Does that count? But I would say, if you add milk in your coffee, yes, you can do so. But actually, right, do you know how much of calcium we need in a day? Do you want to make a guess, like how many mg? You don't? Okay, no idea.
I have no clue, yeah.
Okay, let me tell you. Okay, actually, in a day, we need at least 1,000 mg. This is not what Shan said, right? It's actually based on our recommended nutrient intake. Okay, right. So we need 1,000 mg and one glass of milk, right? You know, the Tetra Pak, the milk, right? So about 200 or 250 ml. It gives us only about 200 mg. Okay, 200 mg or 250 mg, like the most. So like you see, if you want to take from milk, you need at least 4 glasses a day. Are you able to drink 4 glasses of milk a day?
I'm not even sure I can drink 4 glasses of water in a day sometimes. So yeah, man, it sounds like a lot.
Yeah, am I right, doctor? Like 4 glasses, I think it's kind of impossible, right?
Mm-hmm.
Yeah, yes. Correct. So like for me, I'm not able to take 4 glasses because of definitely I count calories sometimes. So and then some people may experience bloated issues, or maybe some they are like lactose intolerance. So they can't tolerate lactose. So yeah, milk, not only milk, actually dairy products like cheese, you know, so all those food are high in calcium. Okay, another thing, let's say if you don't take dairy product, you can also opt for like other options like green leafy vegetables, like spinach, all those, yeah, or even like tofu, right? Tempeh, one of our Malaysians staple food, right? So tempeh is also like good sources of calcium. But since we are not able to take that much, then that's why we would suggest customer to also actually take calcium supplements.
Okay, very interesting. I mean, it also makes sense. Supplements, I guess, also seem like an easier way to keep track of your calcium intake because you don't really know how much calcium the random tempeh you ate has. Like how much tempeh are you gonna eat in a day to make your dietary requirements, right?
Correct.
Okay, that's true. That's very true. Back on the more interesting, like medical side, in terms of, I know there's a thing called like a bone density test, Dr. Putra, where people just like test how strong their bones are. Like, what is that? What does it normally involve? Yeah.
Okay, a bone density test is kind of like an X-ray. The experience is almost like going for an X-ray. You just go there, you step into a machine, they shine some radiation into your body, just like kind of like taking a photo of you. So they focus on three different parts. It's usually the spine and both the hips. Now that the computer puts that into its its processing unit, and it comes out with certain numbers. We call that a T-score. And what we are looking at is how strong your bone is or how dense your bone is compared to the general population, matched to your age. So let's say, Jeremy, I assume you're about 20 years old. So let's say, well, maybe 25. Okay, so let's say if you were going to go for a bone density test, it would compare how strong your bone is compared with everyone else of your age group, around 25. So if you fall like the definition of osteoporosis technically is when you are less than 2.5 standard deviations lower than the normal. Now that's a complex term, but simply what it means is that your bone is 2.5 times less strong than anyone else your age. So that's what we call osteoporosis. So usually these kind of bone density tests, or we call them a DEXA scan. Now that we usually start doing it in ladies after the age of 50, and we do it, most of the time it's done every 2 years. Sometimes if you're on treatment, it can be done more frequent. It is relatively, it's pain-free, it's relatively low cost, relatively low side effects. And I think it's a great way to find out whether you've got osteoporosis or not. And especially I use it when I treat osteoporosis because some patients require medicines for osteoporosis. So when they are on medication, I use it to determine whether this medication is improving things, whether it's getting them stronger. And so we do it from time to time. So that's what I have to say about the DEXA scan. But do you have any more questions about that?
I was just wondering, like, if people should generally like do one every couple of years as part of like a health screen, just to like track their bone density as they grow older. Like, don't wait till you're 50. Find out when you're like 35 and see what happens. You know.
Well, okay. If you've got a strong family history, then that's true. If you know, let's say someone their mother or grandmother had a fracture without going through a serious trauma, they just some people even sneeze and they suddenly get a fracture. You know, that it can be that bad. So if in that kind of scenario, then yes, even at 35, or someone who's going through cancer treatment, they might be 35, but still they should go for a bone density scan. If you're relatively healthy, if you've got no family history, then I would suggest it somewhere around the age of 50. There's no point in doing it too early. But at the same time, other than the DEXA scan, I need to emphasize that there are things that you should be doing from the age of however young you are. Like things like exercise to put weight on your bones to make them stronger, things like getting enough calcium, getting enough sunlight, which is a source of vitamin D. So these are things that you should do from the time you're young. But the DEXA scan probably around 50.
All right, very interesting. Now, speaking on the supplements aspect of things, I mean, there are many calcium supplements in the market to choose from, and I think it's after a while it becomes a little bit scientific. There's a bunch of ingredients on a pack, and so it's a bit hard for the average person to pick one out. So, what are the things we should be looking at in terms of like, this is the one to get?
Okay, right. So talking about supplements, I believe everyone have this doubt. Like there are so many types, so many brands. Okay, so many types of these kind of supplements to choose, or even like nutrients. Some people they say, oh, I need calcium only, or maybe I need to take more magnesium or vitamin D. Right. So I would say, if you want to choose the right calcium supplements, right? I think there are four aspects. Four aspects that you need to take note lah. Okay, so first thing is the type of the calcium, right? So actually, right, in the market, the most common ones are actually we call calcium carbonate. Okay, calcium carbonate or even calcium lactate, which I believe sometimes doctors will also prescribe this kind of supplements to their patients. Right. So yeah, and then there are also other types of calcium, which is quite popular nowadays, which we call calcium citrate and also calcium citrate malate. Okay, so yeah, there are so many types, but what we need to know is the absorption rate. Okay, so honestly, between these few, right, calcium citrate and calcium citrate malate are more highly absorbable, and you can take any time of the day. Yeah, meaning that you no need to pair with meals or any other drinks together, right? So it can be taken even on empty stomach. Yeah, so that's the first one. Okay, second one is actually dosage. Like I mentioned earlier, like you need to take note lah, dosage. One day we need at least 1000 mg, right? So make sure you get at least 800 mg a day, right? So we assume the rest, the remaining 200 mg you can get from your food. Okay, but if on this particular day you can take a lot of cheese, you went to have like pizza or maybe cheesecake, okay, or you drank a lot of milk, then maybe at least 600 mg a day from supplements, right? Okay, and then the third one is the form. Okay, the form of the calcium. Okay, the form of the calcium, right? Actually, we need to see whether it is how good is the absorption is. Like I mentioned earlier, usually calcium is formulated together with its friends. Okay, the friends that I mean here is like magnesium, okay, or even D3. Okay, actually these three, they are always packed together. Yeah, if your calcium supplements have magnesium together, D3, or even other cofactors, then their absorption rate would be higher. Okay, and last but not least, right, actually it's based on individual preference also, because in the market there are like calcium tablets, calcium caplets, okay, and nowadays we have a lot of calcium supplements in liquid and also in powder form. Right, so it depends on your preference. Like for me, I don't really like to swallow tablets, so I can opt for the powder form or liquid form. So it's much more easier for me, and usually, like when it's in powder form, it tastes better. So yeah, it's usually these 4 criteria. You can look through them.
So can I put the powder form in my coffee to drink or not?
Oh, can, but your coffee is hot, right? Usually, yeah. So you see, high temperature will also like reduce the absorption of your supplements. So
Oh, I did not know that.
Yeah,
Oh.
so definitely it's better to maybe just drink with water, and or you can just usually the powder form of supplements nowadays, right? They can melt easily in your mouth also, so you can just take it directly as well.
Oh, very, very cool stuff. I'm definitely gonna have to do a little like supplement shopping after this.
Yeah, you should.
Dr. Putra, in terms of like treatments to alleviate osteoporosis and improve overall bone and joint health, are there like any surgical or non-surgical treatments? Like what happens when you find a patient has osteoporosis?
Okay. Most of the time, remember I told you that osteoporosis remains silent. So it's quiet for many, many years until one day you suddenly found that you broke a bone. Okay. So in that kind of scenario, then of course, surgery may be necessary to fix the broken bone. You put in things like metal implants and things like that to fix the bone. That's where surgery comes into osteoporosis treatment. But generally, we don't want to wait until this happens. We want to catch it early, which is why we have events like this to improve the awareness of osteoporosis in our society. And so when it comes to treatment, supplements are a very big part of it, because when you catch it early, the treatment that is necessary is to boost the calcium, boost the vitamin D. I'd like to maybe summarize, because it might be not so clear, like calcium, vitamin D, and all these things. So basically, your bone is made up of about 40 to 50% calcium. So if you lose that calcium, your bone becomes very weak. Okay. So to answer that problem, you have to take calcium in by mouth, whether it's a supplement, whether it's by food, it goes into the mouth, correct? So then it goes into your gut. It needs to be absorbed, because calcium on its own, if you just take it, it will just go out when you go to the toilet and things like that. So you need it to be absorbed. To get it absorbed, you need to have vitamin D3. So that's where vitamin D comes in. So that's the second part. But once it is absorbed from the gut into the blood, you need the calcium ultimately to get to the bone, all right? Because the calcium in the bone is where it's most important when it comes to osteoporosis. That's where you need another vitamin called vitamin K2. So these are the 3 things that you require. So these are the supplements that I use most of the time. Of course, magnesium also plays a role, like I just said. Other than that, if calcium supplements and vitamin D3 supplements are not enough, if the patient has a very severe osteoporosis, there are medicines that we use to strengthen the bone. generally there are two types of cells in the bone. Now, Jeremy, I know when you went to school, you looked at the microscope and you saw those cells and all that, right? You remember that? It's not too long ago. Right? Yes.
That's pretty long ago, but okay, I remember a little bit.
So in the bone, you've got two types of cells that are important. They are the cells that build the bone up, and they're the cells that tear the bone down. Now, we imagine bone as being a very static thing, like you've just got a bone in there, it just remains forever. But really, just like your skin, your skin changes every so often, every so many days, you've got a new layer of skin growing. The same way your bone is continuously moving. The bone is alive. It's not a dead structure. It's not like your fingernail or something like that. It's actually alive and it responds to what you do to it, which is why, when you go to the gym and you lift weights, your muscle gets bigger. So the same way when you load the bone gets stronger. So if you don't do exercise, you don't do weight-bearing exercises like walking, lifting a little bit of weights, then you don't get that strong bone that you need. So exercise is a major part of it. That's the major part of the treatment. But at the same time, I was talking about two types of cells, right? So continuously, the bone goes through a cycle of being broken down by something that we call osteoclasts. You can remember that C in osteoclasts as cutting down the bone. So the bone gets broken down, and then it gets built up again by something which we call osteoblasts. So the B in osteoblasts, you can think of it as building up the bone. So we have two different types of medicines. One of them acts by reducing the rate that the bone gets torn down or cut down. One of them acts by increasing the rate of building up the bone. I won't bore you with all the details of the medicines, but that's generally how it goes. So we have supplements, we have medicines to increase the bone activity to make sure it gets stronger. And then we've got exercise. And of course, if the bone unfortunately breaks, then we may have to put in some metal devices to make it back into its good function again.
So earlier on, you mentioned like you can strengthen the bone and all that, and also like how like your measurement of osteoporosis or the density of your bone is measured against this kind of like the average of the people your age around you, right? So my question would then be like, if you have like, let's say osteoporosis, you're in that category, is it possible to like build it, strengthen it to a point where you are not within the osteoporosis range anymore, and you are like, okay, you got healthy-ish bones now?
You mean, is it possible to reverse osteoporosis, right?
Yeah.
Yes, it is technically possible, but you really that's why it's important to catch it early when it's not at a very, because okay, I'll give you an example. If your muscles are really, really, really very scrawny, for you to build it up, you really have to work hard. If you want to become a Mr. Universe or something, you really got to work hard. So the same way, if your bone is really, really bad, for you to go back to a normal level, it's not going to be easy. It's possible. But if you catch it early and you're not really, really in severe osteoporosis, it's pretty easy to bring it back up to normal levels. So it is possible.
All right, that's a very nice thought to have. Which brings us to supplements, Shan. I'm very curious about, like, I know LAC has LAC Full Cal, and it definitely contributes to bone health. I was wondering, what are the active ingredients in it?
Okay, on top of that, actually, I really like how Dr. Putra describe how our bone actually breaks down and build up. Okay, so over here in LAC, like what you mentioned, we have LAC Full Cal, right? Our Full Cal, right? Not to really brag about it, but I would say, I would probably present it to say that it is an award-winning calcium supplement, right? So do you remember just now I told you about the form, the form of the calcium based on individual preference, whether it's capillate or not. Okay, so this Full Cal actually is in powder form and it melts in your mouth, right? So you can just pour into it. So you can just bring it anywhere. And like if you have any shooting, if you are hosting any events later on, you just bring it in your bag. Okay, so you can take it anytime. Okay, and then talking about the ingredients, right? The main ingredients, definitely it's calcium. Right, the calcium form, the type of the calcium, actually is calcium citrate, which is the more highly absorbable one, right? Okay, so and then it pair with its friends, which is magnesium. Okay, we have D3 together over here. Okay, like what Dr. Putra mentioned, you need also D3 to help with the absorption, right? Okay, and then also we do have other cofactors like vitamin C, vitamin E. And the special thing about it is we have fish collagen inside. Yeah, so you may be curious, how come like collagen is playing any roles over here, right? Is it for your skin or what? But I would say actually your joints area, right? Your joints, your bones, any part that is actually connecting your bones together, you need collagen for that. So collagen actually helps to lock the calcium within your bone over here. So that's about it. And another thing that I would also like to highlight, right? This LAC Full Cal, we often, when you take calcium supplements, let's say if you have calcium and magnesium together, it's good to make sure that the ratio is in the best ratio, which is the ratio of 2 to 1. Okay, like meaning when you have, let's say 250 mg of calcium, it's good to have 125 mg of magnesium together. So they work together even more happily. So your body absorbs even better. So yeah, it's about LAC.
So like basically when in doubt, just take LAC Full Cal and you don't have to worry about your calcium issues already.
Correct. And it's super convenient, honestly.
I like this. Yeah. So sorry, doctor, you're saying sorry.
Don't forget to exercise also. Take the Full Cal and exercise. Yes.
Correct.
Which brings me to my next question, actually, doctor. Like we spoke, like we touched on it a little bit. We said you need to load your bones a little bit. Don't forget your supplements, and also maybe get some sun. But generally, if I wanted to maintain my bone health as I age, what's a checklist of things I need to make sure I do?
Well, you talked about many of them, but there are things that we didn't touch about. Like, for example, what about alcohol use or alcohol abuse? That's one thing that we need to avoid, especially as we age. The second thing is smoking. So these are things that we should not be doing, correct? But maybe let's look at what we should be doing. You did mention about exercising, and I mentioned it earlier. Now, what kind of exercises do we need? We need to put weight on our bones. So taking a 20-minute walk in the morning, that's a good thing. Not just for the weight-bearing exercise, but also to get your exposure to the morning sun, which helps you to produce enough vitamin D3. Vitamin D3 is not just, you don't just get it through supplements and food, although that's important, but you do need to be exposed to the sunlight, because when your skin is exposed to the sunlight, it can produce its own vitamin D3, which is really important. It's a natural vitamin D3. And so, in Malaysia, a lot of people have been putting lots of sunscreen and sunblock and things like that before they go out. So it's important to realize that, yes, you want to protect your skin, not just for your skin to look nice, but also to prevent against skin cancers and things like that. But at the same time, you do want to get about 20 minutes of exposure to morning sunlight, about 10 o'clock, 11 o'clock in the morning. That's really important. The third thing would be, as you age, it's important to maintain your coordination and your balance, because when we talk about fractures in people with osteoporosis, we are looking at fractures in people who are in the older age group. Let's say, if you're 60, it's kind of like you're still very young. But when you hit your 70s, your 80s, there is a natural tendency of the body to get less coordinated, okay, because of the general wear and tear. So it's really important to maintain your coordination, and you do this by doing some special exercises to improve your coordination. Of course, you can go to a trainer, you can go to a physiotherapist. I actually have a website where I put a lot of these exercises on drputra.com. That's my website. So there's a virtual gym there. So most of my older patients, I send them over there. They go through those exercises and they do them every day, just about 5 or 10 minutes. I think that goes a long way to preventing osteoporosis and also the fractures that are associated with osteoporosis.
Okay. Very, very cool. Thanks for sharing. I'm definitely going to try and implement some of these new tips I've learned into my daily life. What's really also interesting is osteoporosis. Interesting enough, just because of the way it's generally spoken about, and I think because it happens to women at a younger age than men. Like we mentioned, like about 50 years is when women should get their bone density checks and all that kind of stuff. Just does that mean that women also by then should need more calcium than men? I'm just trying to wonder about that. Shan, do you have an answer for that?
Okay, actually, it's a good question. Like commonly, women would have more awareness on taking enough calcium. Okay, in among Malaysians lah. Okay, so men they'll be like, okay lah, I don't go through I don't go through menopause. Okay, and then let's say like tentatively men are more active. Okay, so they will feel like okay, I'm fine, right? But honestly, okay, like what Dr. Putra mentioned. Women, yes, they may get osteoporosis as younger age, but men, you guys are at least also. Remember just now I mentioned about if you're not taking enough of those dairy products, green leafy vegetables. Okay, as simple as if you are not able to follow food pyramid. Have you seen the food pyramid before? I believe you do.
Yes,
right?
I have. Yes, I have.
Yeah. So I believe any one of us here, we are not able to follow, right, how to take your daily food through the food pyramid. Okay. If you are not able to follow, then I believe you need to take calcium, even either supplemented or you need to get more from food. Actually, I would also tell the men out there, okay, actually, not only when you don't need to wait until you are injured or had any fractures like what Dr. Putra said. Actually, there are minor symptoms that you may observe through your daily lives, as simple as maybe like muscle stiffness, right? Stiffness, or sometimes when you have back pain or backache. Okay, or even if you get stiffness, sometimes when for those who are actually active, like after the gym, they did not do proper stretching, and then they may experience like stiffness around the muscle, right? Yeah. So actually, if your muscle is too stiff, it's also a sign that you are lacking in calcium. And lastly, also I also like to add on that if you are not able to really sleep well, it's also a sign that you are lacking in calcium. So just observe these kind of minor symptoms also.
Oh, that's very enlightening. Okay. I mean, now I've got little minor symptoms. Very interesting. But now we've talked about like consuming calcium as like a supplement to improve your bone health. But the question is there such a thing as taking too much calcium? Because I've heard like calcium could cause kidney stones. Like, is that a myth? Is that real? This one's open to the both of you as a question. So, doctor, would you like to start first?
Yeah. Okay. You're right. You're absolutely right. And when you take calcium as a supplement or anything as a supplement, you do need to consider, are you taking too much or not? All right. Now, when I prescribe patients with calcium, with vitamin D, I actually check their blood levels of calcium and vitamin D. The reason is because that at high levels, especially at very high levels, it can be more harmful than helpful to continue to take this. So especially if you have just started taking it, it's a good idea to get your blood checked. If you have been taking it for a long time and you want to know, first of all, it's important to check whether it's effective, because if let's say you have been taking these supplements and your osteoporosis is not improving, then you might have to go to the next level of treatment. So this is why it's important to continue to monitor blood levels. So that's one way you can prevent getting too much of calcium, too much of vitamin D3. The other thing about preventing kidney stones in my clinical practice, what I do is I tell my patients to make sure they get lots of water, lots of fluids, to make sure they don't get too much of calcium accumulated in their body. So these are some ways that I use, but it is possible. The other thing is not to mix your calcium supplements together with things like coffee, which contains oxalates and things like that. That actually can increase the rate of getting stones. So Jeremy, that's enough coffee for you for today, right?
Shan, would you like to add on to that?
Yeah, I totally agree with what Dr. Putra said. Okay, to add on from doctor's sharing, right? Okay, so I would say the dosage of calcium that you take within a day, just be reminded to just follow the RNI or the recommended nutrient intake. Just 1,000 would be good enough. Don't go more than that. Okay, and then another thing, as what Dr. Putra shared also, drink plenty of water. Actually, right, kidney stones can form eventually for everyone if your body forms this kind of salt we call oxalate salt. Okay, and actually a lot of food contains oxalate salt, example like apples, even some of the green leafy vegetables, or even like almonds. Okay, they may also form this oxalate salt. Okay, if you are taking too much, so just reminded to avoid, or maybe to reduce the consumption if you have undergone any checking with doctors. Like, let's say if the doctor say that you should watch your calcium intake from daily food, then you need to take note lah. Okay. Otherwise, and also like people who already have kidney issue, or those who are already undergoing dialysis, then we would suggest you to ask your doctor first as well before starting any supplements.
All right, that's very cool. Now, as a final question, we were talking a lot about how osteoporosis, generally, we talk about it in terms of like people who are older, 50, 70 as an adult. Now, what about like younger people? How can we encourage like young people to think about their bone health? Are there any special considerations that children or teenagers should be thinking about? Maybe for the parents who are watching, want to make sure that the kids are okay in that regard. Open to the both of you. Doctor, if you would like to start.
Okay, actually, that's an amazing question. In fact, much of recent research actually shows that even though we think of osteoporosis as being a disease of older people, but actually it starts during childhood, because you don't suddenly become lacking in calcium at an older age. True enough, yes, hormones play a role and things like that, but actually it can start in childhood. So it's really important to make sure that when you have young children, that it's important to educate them on dietary habits, especially when it comes to dairy products. Of course, you wouldn't want to start calcium supplements for a young child. I wouldn't do that. But it's important to make sure that they are trained, and they know that what is important in their diet is enough dairy products, enough green vegetables, not too much salt. Salt is another thing that can actually lead to lack of calcium, because it washes out calcium from your body. All right, so too much salt is not a good thing. And also the importance of exercise. So it's the same thing again. It's just that we need to start implementing it when the kids are at a young age. That's when they need to start the good habits, which I think you're still young, Jeremy. I think it's a good time to start now.
Shan, would you like to add to that?
Yeah, I would say that depositing calcium in your body is as important as depositing money in our bank account. Right, like our parents teach us to actually remember to do saving, right? Since when we were young, right? So you should start as young as possible, and not neglecting like teenagers. Okay, just now we were mentioning about people who are above 50, right? So actually, like teenagers, they also need higher amount of calcium compared to us adults. Because at their age, it's like during the adolescence age, right? They are undergoing their puberty. So parents, they also need to take note on their diet, okay? And like what doctor mentioned, reduce salt intake. So please try to reduce like fast food, processed food, you know? So I noticed that even like kids at my home, I mean like my cousins or nephews, nieces, they like to take fast food, processed food. So it's actually the enemy to our. So yeah, they really need to take note on your diet.
I find like our entire conversation today has to have me like rethink my lifestyle choices on so many levels, guys. Well, okay. So thanks so much for sharing. For more information on LAC Full Cal, scan the QR code now. We're going to put up a QR code on the screen. Feel free to scan it, or visit lacworldwide.com.my and search for Full Cal, or head to your nearest LAC store. Now, in conjunction for Mother's Day celebration month, we have a promotion, store-wide health supplements, which is buy 3 at 33% off with free gifts. Once again, it's a promotion for store-wide health supplements where you can buy 3 at 33% off with free gifts. And with that, I want to say thank you so much, Dr. Putra, Shan. Thanks so much for joining us. We found the conversation today extremely informative, extremely engaging. I just want to say thank you so much for joining us.
Thank you, and I learned a lot as well. Thank you.
Yeah, I really love the session. Thanks, Dr. Putra. Thanks, Jeremy.
Thank you, Richard.
And of course, a huge thank you to all our viewers for tuning in. We'll be back next week with another exciting episode. Come join us for more insights and tips on how to stay healthy and happy. Until then, take care and have a phenomenal week ahead.
Bye.